Noem has proposed cutting annual state funding for tobacco prevention by 60% in that state, a move that worries anti-tobacco advocates. South Dakota News Watch reporter Bart Van Cook has the latest tonight on the proposal.
Representatives of the American Cancer Society and other groups say reducing annual funding for tobacco use prevention from $5 million to $2 million a year could lead to more smoking and vaping by children, higher death rates for adult smokers, and millions more in future health care costs. The $5 million in current annual funding for the state tobacco prevention program comes from a higher tobacco tax approved by voters in 2006. Due to the program and other factors, smoking among adults and youths has dropped off dramatically in South Dakota, though vaping remains an issue for youths as early as middle school. A Department of Health spokeswoman told Newswatch that less money is needed for tobacco prevention because far fewer people are using tobacco. No details have been released on what specific programs or personnel might be eliminated due to the $3 million funding cut. But a finance official said state and local programming, including the successful South Dakota Quit line, will continue. Jody Radke, a policy analyst for the Campaign for Tobacco-Free Kids, opposes the cut, saying a funding reduction could have disastrous health and mortality consequences. Anti-tobacco advocates note that the funding hasn't increased in more than 15 years and that tobacco companies continue to spend about $25 million a year on marketing of a host of new tobacco and nicotine products in South Dakota. Those worried about the potential effects of the cut say they will lobby lawmakers hard to hopefully sustain the current funding level for tobacco prevention. A Cancer Society lobbyist said the cuts are a way for Governor Noem to find money in a tight budget year for new spending she supports, including $4 million in new money for education savings accounts. For South Dakota News Watch, I'm Bart Van Cook.